Good morning, everyone. Bonjour tout le monde. The press conference with Green Party Leader Annamie Paul will now begin, and guest Maureen McDermott, Voices of Long-Term Care. Bonjour tout le monde. Alors, la conférence de presse avec le chef du Parti vert, Annamie Paul, va maintenant commencer, avec l'invité aussi, Maureen McDermott, Voices of Long-Term Care.
Bonjour tout le monde. Merci d'être avec nous aujourd'hui. Good morning, everyone. Thank you very much for being with us this morning. I'm going to just touch upon a few things very briefly and then pass it to Maureen and thank her very, very much for being with us once again to sound the alarm bell on long-term care and the continuing humanitarian crisis in long-term care. Very quickly, I've noticed that there has been renewed media and statements by federal leaders with respect to decriminalization of drugs. As someone who ran in Toronto Centre, a riding that has been the epicenter of the opioid epidemic across this country, I want to be clear. I want to give straight talk to Canadians, which is what they deserve, and say that we support the decriminalization of drug possession. And more than that, we support the creation of a safe supply. Drug addiction is a health emergency. It is not a criminal matter. And we want to make sure that people have access to a safe, screened supply and the medical support that they need to combat their addictions. We know that as of just the spring of 2019, we had almost 13,000 Canadians who had died of opioid overdoses. And we know also that there has been a tremendous spike in opioid poisonings. And we call them poisonings because that really is the issue. It's poisonings during COVID-19. And so we want to be clear. We want to be on the record. We have said this for many years. That is what we support. I also wanted to draw your attention to a student town hall that we'll be hosting at 3 p.m. Eastern time tomorrow with student federations from across Canada. The point here is to make sure that we understand that there are still those being left behind. And again, to remind the Prime Minister of his commitment to do whatever it takes for as long as it takes to protect every single person in Canada. In the case of students, we know that the benefit that they received and had to fight very hard to receive was only cents on the dollar when compared to the CERB. We know that that benefit ended at the end of August. We also know that the tens of thousands of summer jobs that were promised by the government did not materialize, partially because of the WE scandal, but also because of a lack of organization, and that over 40% of students did not have jobs during the summer. Students need help. Students come in many forms. Many students are self-funding their education, and they're now struggling with crippling debt, those who even manage to return at all. And so we'll be speaking about those issues and the solutions. The Green Party supports universal post-secondary education. We're the only party to support universal post-secondary education, and we'll be discussing that tomorrow. With respect to vaccinations, again, let's have some straight talk and some plain talk. We know that this week and next week, we will virtually have no new doses arriving in Canada. And we know that that has major implications, particularly for those most at risk, including our long-term care residents. So first, we have to say that and acknowledge that clearly and not disguise it or obfuscate by talking about how many doses per capita are coming at the end of the year. We have to face this particular challenge head on and talk about how we're going to make sure that our most vulnerable people in Canada are protected during this period until we get our vaccine doses up to the levels that we need to, and we expect to see in the second quarter of this year. And so, turning again to long-term care, this has real implications. I'm so happy to have Maureen with us today on behalf of Voices of Long-Term Care. We know that just recently, we've seen almost 50 deaths in Roberta's Place and 214 infections due to the new variant that is now circulating within our country, within our some of our long-term care facilities, that is incredibly deadly and moves with devastating effect. And so given that we do not have enough doses and we will not be able to vaccinate everyone in long-term care as quickly as we need to, it's extremely important to remember that we have got to make sure that we are doing all the other things that the health experts have told us need to be done to protect our residents. We are calling for a First Minister's meeting because this is an urgent matter and things can be done today rather, to save lives immediately. Amongst those things, increased PPE, greater staff and staff training, a stabilized staff, making sure that each patient has at least 4 hours of care. These are just very basic things that should have been done and can still be done to save lives as we wait for our vaccination program to fully roll out. Alors, en français, d'abord pour dire que je sais qu'il y a plusieurs chefs de parti qui ont parlé ou discuté le thème des drogues et de la criminalisation des drogues. Je veux être clair que le Parti vert soutient une décriminalisation des drogues, de tous les drogues, pour assurer qu'il y a accès à des drogues saines dans un contexte de santé et avec le soutien nécessaire pour assurer qu'on commence à voir un déclin dans le taux de mortalité à cause des empoisonnements opioïdes. Le Parti vert est le seul parti de soutenir une décriminalisation totale. Moi, autant que candidate dans la circonscription de Toronto Centre, qui souffre énormément de l'épidémie d'opioïdes, je veux voir ça fait sans hésitation parce que ça va sauver les vies. Je voulais aussi dire que demain, nous allons convoquer une assemblée des étudiants, les fédérations d'étudiants, pour discuter les options pour mieux protéger les étudiants pendant la pandémie. On sait qu'il y a beaucoup d'étudiants qui n'ont pas eu d'emploi dans l'été parce qu'ils n'avaient pas d'emploi, même que le gouvernement a promis beaucoup d'emplois. On sait qu'il y a beaucoup d'étudiants qui ne reçoivent aucun soutien, aucune aide du gouvernement et qui a des prêts qui sont un énorme stress pour eux. Le Parti vert, on appelle pour accès à l'éducation postsecondaire totalement universelle et on sait que plus que jamais, c'est nécessaire. Pour les vaccins, c'est très important de savoir que nous avons un problème, même si c'est un problème de court terme, qui a un impact direct sur les personnes les plus vulnérables dans notre société. Il faut être clair et honnête avec les Canadiens sur ce fait et comme ça, créer un plan d'action pour adresser le risque que le manque d'accès pose en ce moment les personnes plus à risque. Alors, on sait que, par exemple, à Roberta's Place, il y a presque 50 morts causés par le nouvel variant du COVID qui commence maintenant à circuler dans nos centres de soins de longue durée. Et c'est pour ça qu'on appelle encore au Premier ministre de convoquer une réunion des premiers ministres en urgence pour discuter un plan d'urgence pour assurer qu'on arrête que nos résidents de centres de soins de longue durée continuent à mourir. Nous avons dit qu'il y a beaucoup de choses qu'on peut faire dès aujourd'hui pour protéger les vies dès aujourd'hui et encore, on ne les fait pas. Alors, il faut absolument assurer qu'on protège nos citoyens les plus vulnérables et on fait l'appel encore et je suis vraiment contente d'avoir Maureen avec moi. Maureen? I'm going to pass it to you now. And if you could just maybe share with the folks an update on what you're planning to do over the next couple of days to continue to sound the alarm and what you're looking for. Oh, you're on mute.
I even had a note, unmute. Happens every Zoom call. I just happen to be the one. Thank you very much for having us on, having myself and the Voices of Long-Term Care. Your recognition and this province has certainly started recognizing Voices of Long-Term Care from our protests that we did last week online was a massive success. And unfortunately, one of the successes about it was the horrific video footage that was put out. We actually couldn't even count how many videos were submitted because it was just causing so much trauma to watch all of them. So we thought, we don't even need to count these. We know that there's hundreds that were sent in, over hundreds of thousands of people tweeting, retweeting. So we have the outcry, and now we have the Doctors for Long-Term Care Justice, and they started out with 200 signatures a few days ago. Not sure what the number is today. Yesterday, that was 800. I think the message is clear for the provincial government that enough is enough. The time is up. The time for cover-ups is done. And it is now a humanitarian crisis. It's a nonpartisan crisis. This has gone way beyond any kind of politics. And it has to stop. And people have to be accountable for, again, I've stopped counting the numbers of deaths in long-term care. I think it's creeping up to around 3,400. And we do know that that is one per hour. So the message is clear. The government knows what's happening. I'm not sure who's writing their scripts these days. I watch the pressers that come out, pretty alarmed with Christine Elliott putting the onus again on hospitals to fix this humanitarian immediate crisis that's in long-term care. And then you can switch to another channel or wait 5 minutes and there's a report about hospitals and how their ICUs are impacted and how doctors are traveling around because they just don't have the care. So we all know it's a time to fix it. We have started a movement. As I said, there's us, there's the doctors, there's so many other organizations and people just screaming out, enough is enough. So today we are going to highlight the absolute tragedies that have happened in Roberta's Place. We're going to dissect that as to clearly how it could have been prevented, including the outroll of vaccinations, taking their time to get into Roberta's Place, the cover-ups, the inspections that are glaring as to the issues, and that's just one place. So we have an amazing panel with us this afternoon, and we'll continue the talks and we'll continue our action plan because the talking has gone on long enough. We're really tired of the messages that we're hearing from the provincial government. And I can tell you personally, as a family member, so many times when they open their mouths, they may as well just line up every single family member and directly slap us across the face. And that's including Fullerton and her misinformation and her target on the NDP. I'm sorry, but it's these people that are giving us the facts, the real straight facts, and not the cover-up. We've got to stop the cover-up. I'm terrified what's going to happen when we do crack open Pandora's box. I think we're going to be even more disappointed and more thoroughly disgusted how having profits in long-term care has turned greed into overvaluing lives of Canadians, lives of seniors. My mom, the 3,400 that are now gone, the staff that are dying, 19-year-old Yasim, come on. What more do we need? We need the CAF in.
We need action.
We can have them in tonight. I actually Google mapped Roberta's Place in Baseborden, where the health teams are, 24 kilometers. We can have them in by lunchtime.
Yeah.
Make the call. That's
Make
our
the
whole
call.
premise today, is make that call. We're telling you. Not sure who that mystery person is that told him not to. I'm not sure if you saw that when Doug Ford was asked a question by media. Why not the CAF? I was told not to. And then it moved on to talking about travel, airports, where they all showed up for a non-essential trip to the airport to do their little photo ops and press ops. That's really got to stop. You know, there needs to be some intervention. We're going to be talking provincial and federal, you know, and how we can stop that, basically the intervention coming from the federal government. I know there's jurisdiction issues, so we need to hammer out that glitch and make sure this never happens again, because we're not stopping at second wave by the sounds of things. Some fear is that the third wave is actually starting before the second wave is over. So we have some serious work to do, because the people of Ontario, they can't take much more.
Thank you very much, Maureen. And that says it all. And I think that we can leave it there. This is an ongoing humanitarian crisis unfolding before our eyes. Canada has the worst record for long-term care deaths. This is something that is preventable, continues to be preventable. And thank you so much, Maureen, and Voices of Long-Term Care for raising your voice. And we are starting to see some action, I think, as a result of the families continuing the pressure. And with that, I thank everyone. Merci beaucoup à tout le monde. Et je suis prêt à prendre des questions s'il y a des questions.
So we will take questions. If there are any questions, please use the raise hand feature if you would like to ask a question. And it is one question, one follow-up. Alors, on peut commencer les questions. C'est une question, un suivi. Veuillez utiliser la fonction de lever la main si vous voulez poser une question. Okay. There are no questions. Pas de questions. So this will conclude this press conference. Ceci conclut la conférence de presse. Merci beaucoup à tout le monde. Thank you so much to everybody.
Merci
Thank
beaucoup.
you so much for your time.
Thank you, Maureen.
Merci.